Intramedullary nail is a load sharing device, but this can be load bearing as well if there is significant bone loss. Load sharing and bearing is a concept and not a device. What affects the torsional rigidity of or moment of inertia of the nail? Number one, type of material. Number two, structural properties. If it is a solid nail, the bending and torsional rigidity is proportional to the fourth power of the nail diameter. If it is a hollow nail, then it is proportional to the fourth power of the outer minus inner radius. Working length of the bone is between the proximal and most distal fixation points. Reaming will reduce the working length by jamming a bigger size nail. A fragmented fracture will increase the working length, and partial weight bearing may be advised. Transverse fractures have a shorter working length. Full weight bearing is possible. Slotted nails allow compression by isthmus and tighter fit. Reduced nail mass will reduce ability to resist force and rigidity. Slot disrupts the hoop stresses and reduce rigidity and resistance to torque. Hollow nails are more flexible to anatomical variation than solid nails. Reduced rigidity due to reduced mass compensate by reaming and using a larger nail. Increased risk of bacterial infection persist. End caps are used to prevent bone ingrowth. The generation of nail, the first generation is the antegrade nail, which is the centromedullary nail. Second generation is a recon nail. The proximal diameter is 13 mm. Third generation is a PFN or a gamma nail or a TFNA. This has a 16 mm wider proximally and has a single sliding screw. Fourth generation is interton. Interton has 2 screws. The interlocking screws provide axial and rotational angular stability. Increased radiation exposure is a problem. Holes weaken a nail. A nail extractor system is called cormus.